not the other, not not the other girl, but the girl that was definitely supposed to be doing the sessions with me. Uh, it ain't gonna happen because
Oh,
she gave me a crazy excuse earlier today, and I'm like,
okay.
this doesn't make no sense. Um, yeah, but okay, so all right, so I gotta figure out how to oh, here we go, share. All right, you should be able to see it now. Can you see it yet?
No.
Oh, all right, now we're good.
Okay. Did you click on the document that you're sharing? Because it's just saying a black screen.
You
So unshare, you working off one screen?
should see it now.
There we go. Okay.
All right, see the PD?
Mm-hmm.
All right, so I highlighted stuff that I thought was pertinent to know, but I have to figure out the main thing is I'm not as concerned about the factors because that just takes time and I can go
Yeah.
through that for the
Right.
most part.
Yeah.
But when they give me this, um, not giving me the series at all, I'm starting from scratch.
Yes.
So, so this is great practice, but it's very hard for a newbie because we
So
might
no, so
get it wrong.
normally, so if you in your thought process, where would you start? I see you've already highlighted some information. Remember the primary purpose of the position.
Right,
Okay.
right.
The primary purpose
And
of
so that's what I thought this. So I thought this here was it. This here in the yellow.
right.
The position is responsible for accurately and efficiently completing a variety of dictated reports using office automation systems in order to support the team as needed.
Hmm. Excellent. Now, the second thing you would do is I will go to the Handbook of Occupational Groups and Families. Or you can look at the series standards and try to figure out what series it is. But the Handbook of Occupational Groups and Families gives you a gives you a series definition for every series in the federal government. And so we know number one that it's clerical, and we know number two that they're using office automation systems. And so you can either go to the Handbook of Occupational Groups and Families, or you can go to the list of the occupational groups, because you know every occupational group is listed into a category with four numbers, right? And then when you get to the series, it breaks it down into those specialties within that occupational group. So the 300 occupational group is the general, administrative, clerical, and office services group. And so we know clerical is there in this
Mm-hmm.
PD. And so then you can either go to the Handbook of Occupational Groups and Families and read the series definitions for all of the clerical positions that they have in that 300 group, or you can look at each series standard by clicking on the 300 group and going through it. And so when I look at it, it has the first one is miscellaneous and administration and program series. That's two grade intervals. So no, we know we don't want that. And so there's the 303 miscellaneous clerk and assistant series.
Okay, hold on. Let me pull it up because I don't have it on the screen.
Okay.
All right. So you want me to pull up
The list of all of
Occupation.
the occupations in the 300 series. When you go to the series standard, when you click on the standards, it'll list all the occupational groups. Then click on 300, and it'll
Right.
list all of the positions in the 300 group.
Okay. Classifying schedule positions standards. All right.
And so you see all the occupational groups first. If you click on the 300, it'll open up to the whole list of everything that's in the 300.
Okay.
And so what you do is you wanna, because you know it's clerical, you want to look at all the ones that say cleric, clerical or clerk or assistants. And so we see the miscellaneous clerk and assistant series is the 303. And then we see the 320. Well, what's next? Let's see. We know it's not correspondence. We know it's not secretarial. Closed microphone reporting series. I don't know what that is. That's probably a court reporter. The clerk type is the office automation clerical assistant series. And so you want to put a pin on that one.
Mm-hmm.
And then, excuse me, one second.
Mm-hmm.
Okay, let me put this on silent so they won't be calling me. Um, and so the office automation and assistant series, you want to put a mark on that. We know it's not totally computer operations because does it say what type of equipment that they're using? It says a variety of dictated reports using office automation systems. Does it say what kind of system that they're using? Under the office support on the PD, it says transcribes, um, priority stat documents in a timely manner. The incumbent will digitally record medical dictation into formatted computerized medical records. Documents such as, and so computerized dictated into medical records, digitally dictated into formatted computerized records. And so let's see. Um, computer clerk and assistant pr- support. No, 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 no. Logistics equipment. No, no, no. Data scriber series. The 356. Okay, so let's look at. And so, have you familiarized yourself with the PD in its entirety? Pretty much. You on mute.
Yeah, I did a good fair amount. Let me go back to it. Everything that I highlighted is what I went over. So
Okay.
um,
Okay.
it's the first parts of it is kind of short. So you got a
Mm-hmm.
correspondence section of 40% and office support of 70%. So obviously this is the most important
Mm-hmm.
part of it that I need to pay attention to. So on here, um, transcribes, um, and then the incumbent will digitally record medical dictation in formatted computerized medical record documentations. So it took me a while, but I thought that this person would be when you go to the hospital, the person that is doing general information, gathering information before you see the doctor or physician assistant.
Hmm.
So I thought of this as the person that's basically doing the intake when you first
Right.
arrive on site. Um, yeah, so that's what I
Yeah.
thought
But does it
when
say
it's
that? It doesn't
transcribed.
say that. Does it say that? Look at the contact session section. Look at
Which
the
section?
in fact, what factor is the context? Factor six? Look, is it in FES format or is it in narrative format? It's in FES. Okay, look at factor six.
Personal contacts. Now, this is
Yeah.
what threw me off on this one also. Personal contacts are limited, but potentially include clinicians, administrative personnel, etc., as well as dictation equipment vendor in times of emergency. So
And
this threw
so,
me off.
yeah, because that would tell me right there that that person is not sitting out working with the public.
Okay, and that's right, and that's what I gathered from that.
Yeah,
Right, from that.
yeah.
But if we go back to
Okay, go back.
if we go back to here, um, the incumbent will digitally record medical dictation into format computerized medical record documentation.
Okay,
So
so think about and this a hospital? This is a hospital, right?
this a this position is in the health information management section of the medical center,
Okay.
which has
Hmm.
been proudly providing care,
Yeah,
blah blah blah
that's
blah. All
fluff.
that.
That's
Yeah,
fluff.
yeah. And then the position is responsible for accurately and efficiently
And
completed.
so,
Okay.
um, in a hospital, it looks like they're working, even though they didn't say it, in medical records. And so the doctor writes down everything on the patient on pen and paper,
Mm-hmm.
and this person is transcribing it, whether it be typing it or
Mm-hmm.
probably typing it into the employee's record, I mean, the patient's record,
Mm-hmm.
what I'm getting.
Right.
And so
That's
they don't have to have any contact with the public because they're only dealing with the medical staff and employees, patient records to me.
so okay.
And so, um, if the if the doctor says if I work on a team and my team handles, elderly people, and the doctor says, in the employee, the patient record, um, this patient was seen on X amount of day, and these are the symptoms that they were having. This is my diagnosis. These are my recommendations. And so they're typing that from what the doctor wrote in a
Mm-hmm.
paper chart and putting it into an electronic file.
I can agree with that. Yep.
And so
Exactly.
then if that doctor, if she's working on the team, he or she is working on the team, if the doctor may say also that this person needs to have, Medicare, I mean, home in care visit.
Mm-hmm.
Maybe they'll forward it to the home care group and say, doctor recommended that this person have home care visit.
Okay. And that seems to be accurate because if you look at factor seven, the purpose of the contacts are for such purpose, receiving work assignments, getting instructions, receiving or giving information, reporting progress or problems, clarifying terminology, delivering completed work, and or providing information or documents, as well as coordinating the work of the service line. Yeah, so yeah, I agree with you on the medical records. The purpose of it is to make sure that the medical records are accurate. I get it. That seems right. Um, Now going to series though, 'cause I think I looked at something along the lines of medical records,
Mm.
and oh, here we go. So records and information management series. You see that one? 308.
Railway. Mm-hmm.
Uh,
Mm. It's a fly sheet. Now, the first thing you do when you go to the fly sheet is look at the well, and this one doesn't have it has coverage. And so,
my screen loading. My screen's not loading. Hold on.
okay.
I don't know why it's taking so long. It's normally fast. Let me try to close it and reopen it. Oh, here it goes, finally.
And so every time you look at a series definition of what is covered under that series, you want to
Mm,
make sure that you determine what category, what PACTO category it's in, whether it's professional, administrative, um, technical, clerical, or up. And so
right.
this 308 series, it says, covers on the following series: records and information management, establishing the occupational series, establishes the occupational series and provides grading instructions for work covered by this series. And it says administrative analysis grade evaluation guide, which is a 2 grade interval position. So that's not a clerical series because it would say
Okay, hold
clerical
it.
assistance when it talks about what the series covers.
Okay. Um,
You see that?
all right, let me catch up here. I had to close the screen and
Okay.
reopen. So it's opening now. Yeah, it's not populating on my computer, so I can't see the 308. It's not oh it's coming slow. All
Okay.
right, so under coverage, it's still thinking, but it's showing up on the screen now. This is a fly sheet, but it's got 13
Yeah.
pages. I thought fly sheets were short.
They are usually are. This and so this one is relatively new. They may have because it was done in 2015. It may have um changed the bar.
Hmm.
And so because it has a lot of explanatory information in it, it references the law and what the law requires for um, records and information management. And so, um, yeah, but this is a 2 grade interval position because it says administrative. It's not a clerical position. It's not a 1 grade interval position. And so
Okay,
you
so
tell that by the coverage. What is standard coverage?
okay, I can't see the coverage. For some strange reason, I'm only getting the first page is the only thing that's loading up.
Oh, really?
But Yeah,
Huh.
on my normally I don't have any computer problems, but that's all that's showing up. I'm trying it for the last time.
Let me see. Okay.
But you're saying that there's a passage in there that says that it's um an
Yeah,
administrative position.
I'm gonna stop yours for 1 second. Up to. I'm gonna pause your share and share. And so
Mm,
I got a couple of windows open. So this is the 308 flash sheet. You see it?
not yet. My computer normally doesn't act this slow, but it is today. Um, all right. Select the window or application that you want to share. Okay. All right, I see yours now. All right, I see yours now.
The 308. And so when I go to coverage,
Mm-hmm.
it tells me right here what this standard covers. This position classification flash sheet covers the following occupation series, records, and information management 308. And so establishing the series. The issuance of this flash sheet establishes series and provides grading instructions for work covered in this series. And in 2015, it was a new series. And so, but it's referring you to the Administrative Analysis Grade Evaluation Guide, which is a 2 grade interval guide, functional guide. So we
Mm-hmm.
know that this is not, it would say that this was a clerical position up in here if it was clerical. And so the
Okay.
308 is always going to give you a prompt to tell you um, what pacto category it's in.
Mm-hmm. That's always going to be in the coverage area.
Yeah, it's either going to say series definition or coverage.
Mm-hmm.
And so the reason for the position's existence, the primary purpose of the position or management intent in establishing the position is a positive indicator for determining the appropriate series. And so you want to you can look at the occupational information, but I'm almost certain, no, I'm not almost, I'm certain that this is a 2 grade interval series. And so it talks about supervisors and leaders, parenthetical titles, um, organizational titles, how they're determined. But then it gives you the type of work. And so when you go into the series definition right here on the side, this series
Mm-hmm.
includes positions with supervise, lead, or perform records, information management work, which includes planning, controlling, directing, training, and promoting other activities with respect to records creation, records maintenance, use, and disposition. And
Mm-hmm.
so it doesn't say nothing about clerical. You see
Mm-hmm.
that? You know, it doesn't say anything about clerical.
So the
That would
difference,
eliminate that series.
okay. So administrative 9 times out of 10 involves some form of these items, the
Yeah,
planning and
administrative is your specialist, your analyst, your 2 grade interval work.
mm,
And so it has to say clerical or technical or assistance to be 1 grade interval work.
okay, so clerical, technical,
Or
or
assistant.
assistant,
Or
not
it may
admin,
say
not
assistance like human resource assistance or
right, but
assistance.
right, but as the last thing we talked about, that's different than administrative.
Right.
Right.
Administrative, though they may do clerical folks may do some administrative work, it's not their title's not going to be a specialist, an analyst, or those kinds of things. They're not going to
Right.
get 2 grade interval. They're not going to be 2 grade interval work. And so that's how you determine when you're going through all of the series that you're eliminating. So what I suggest is um to make a list of all of the possible series it could be. And
Mm-hmm.
then go through, like now you said you thought it was a 308. You can scratch 308 off.
Mm-hmm.
Then the next one, out of the list, da, 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 miscellaneous clerk series.
Mm-hmm.
I would eliminate this because of the automation that they use, the dictating equipment. I would. And
Mm-hmm.
so this series includes positions of the duties of which to perform supervised clerical assistant or technician work for which no other series is appropriate. And so it could be you could use this, but we're going to see. The work requires knowledge of the procedures and techniques involved in carrying out work of an organization and involves application of procedures and practices within the framework established in the guidelines. And then it talks about how what is superseded, what the series was in the past. And so when you look at the coverage, the purpose of this series is to cover one grade interval work, which is not elsewhere classifiable. Essential criteria for classifying positions in this series are the primary, that the primary work of the position is one grade interval in nature, and the primary work of the position is not classifiable in any other series. Okay. And so what I would say is for right now, we're going to put this 303 series on hold. Okay.
Mm-hmm.
We're going to put it on hold. And then we're going to look at something else. Let's look at the office automation clerical and assistant series. That's the 326. It's a fly sheet. And let's look at the series definition. And this is how you do the process of elimination.
Mm-hmm.
This series includes all positions, the primary duties of which are to perform office automation work, which includes word processing, either solely or in combination with clerical work when such work is performed in context of general office clerical support. It also included our positions that supervise work, characteristic of this series, skill and abilities for general office automation work, which are essential requirements for the supervisory position. And this position requires knowledge of general office automation software. Now, is the dictation equipment considered office automation? That's the first question you'd ask yourself. Is this
Mm-hmm.
dictation equipment considered office automation software? Do they have to have um, proficiency in typing?
Yes, and that's the thing that threw me off because it said that they did have to have. I don't know if I made this up with the 40 words per minute, but it
I
did
think I
definitely
think it's all right.
say
Something like that. It's something like 40 words a minute. And
right.
so, and the ability to apply knowledge and skills in the performance of general office work. Okay. So we're gonna put this 26 on hold too. Okay.
Mm-hmm.
Before we dive deep. Let's look at, I want to look at three. What do I want to look at? I wrote it in my phone when I was looking at it from your note you had sent me the other
Mm-hmm.
last week.
Mm-hmm.
Because if I don't write it down, man, I'm telling you, I'm gonna forget. 356. Let's
Mm-hmm.
look at 356. Data transcriber series.
Right, because they mentioned transcribing in the beginning.
Yes. This series covers positions that involve operating or supervising the operation of keyboard control machines, such as card punch machines, these are old machines, paper tape recording machines, magnetic tape, or disc encoders, optical character equipment, and computer controlled data entry. I'm thinking that this may be because this was written in 75. The language may have changed, but is it comparable to the type of equipment that this position is going to be using?
Right.
Update, um, update, and remote inquiry devices to transcribe or verify data from a form that can be used in automated data processing systems. The work requires one, skill in operating a typewriter or a modified typewriter style alphabetic numeric da 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 for speed and accuracy. Two, the ability to understand and apply machine operations and data transcribing procedures. Data transcribing work is combined with clerical work combined that is combined with clerical work is covered in this series unless the clerical works require specialized experience or training that constitute the paramount qualification requirement. And so, um, let's see what the exclusions are. Let's see if it excludes transcribing medical information.
Mhm.
And so positions involved in operation of specifically adapted typewriters to produce typed copy and punch tape. You know, the court reporters, how the court reporters sit in the courtroom and they had that little teeny box that talks about some of that. Um,
Mhm.
it's used to produce material automatically, either as it was typed or altered. This work requires typing skill and knowledge of grammar, spelling, punctuation, and narrative of tubular. Such pictures are classified in the Clark typist series. But because they are transcribing and not just typing, then it's not Clark typist. And we know it's not um, number two exclusion, computer operations, because it's not, the position is not involved in the operation of computer consoles.
True.
Only solely in the support of computer operation. And so to note, some data transcribing equipment has the capability of entering data directly into a computer system and of retrieving and modifying records stored in the system. Sound like what you're working with?
Mhm.
And so this is where your analysis skills are going to have to kick in. When you hear managers um that say it takes them a long time to get a position classified, then this is why, because classifiers have to go back and forth. Now I want to look at one other one. I think it's six. Did you say six something one time?
Yeah, I thought it was 679, but
675. Did they eliminate 675? Where's 675? Why is 675 not coming up? Let's see if it's in the 670 series. 671. That's a specialist. Let me see if it's in the 670 series. Is that a job family standard? Nope. It's not a job family standard. Okay, so let me go. I'm going back to what I'm going to do is I'm going to the Handbook of Occupational Groups and Families to go to the 600 group and look at all the series in the 600 group. That's the medical, hospital, dental, public health group. And it's only going to give me the series definitions. Okay? It's not going to give me any other information. 601. Let's see if it got a 675 in here. Well, you said six, what'd you say? Six what?
679, I thought.
679. Let me see if though, because they're not in that list. Let me see if it exists and what they tell you to do if it exists. And so as you're documenting
Mm-hmm.
for training purposes, you can make a little statement about why it wasn't these different types of series, and then determine and say why you selected the series that you selected. 665. Come on now. Put that. Now look, so let me show you something.
Mm.
The series that has their title highlighted
Mm-hmm.
has a standard. The ones that don't, doesn't have a standard. It gives you more information about how to classify the position because there's no standard developed for that series. And so that's probably the instance for the two that we're talking about. 675. Well, it says it's got the medical records. Did I say 675? I said 675. I wonder why it wouldn't show up. A medical records technician series.
Mm-hmm.
This series covers one grade interval technical support positions that supervise, lead, or perform support work in connection with processing and maintaining medical records for compliance with regulatory requirements. This position covers positions that review, analyze code, abstract, and compile or extract medical records data. The work requires practical knowledge of medical record procedures and references and organizational consistency with medical records. Positions also require a basic knowledge of human anatomy, physiology, and medical terminology. And there's a 679 series that you said. This series covers one grade interval administrative support work that supervise, lead, or perform support work in connection with the care and treatment given to patients in wards, clinic, or other units of a medical facility. The work includes functions such as serving as receptionist, performing record keeping duties, providing miscellaneous support to medical staff in the unit. This series includes work that requires practical knowledge of computerized data entry for information processing, medical facilities organization and services, basic rules and regulation governing visitors and patient treatment, and the practical knowledge of standard procedures, medical records, medical terminology of the unit supported. And so let's look at this 679.
Mm-hmm.
That's background information. Okay, so that's titling information. 675, oh, they're together. The 675 and the 679, they put them together. So we read that. Let's look at the occupational record information for the 679 first. And so it's going to give you an idea of the type of work that the 679 does. And so medical support assistants provide a variety of support to facilitate the work of physicians, physician assistants, nurses, nursing assistants, and other members of the faculty, medical facility, excuse me, provide patient care. Let's see, they receiving and relaying incoming and outgoing telephone intercom, receiving and directing patients and visitors, questions concerning patient conditions, assembling patient records according to prescribed formats, inserting additional forms and charts necessary for stamping them with the correct identification, filing results of treatment and medical records, reviewing patients' charts, um, and recording a variety of medical data, determining patients' eligibility for treatment, travel, expenses, recording physician's orders, Um, Selecting, completing, and routine requests for patient activity, treatment procedures, scheduling an appointment for patients and medical services, preparing patient census reports, keeping time and attendance. They also have knowledge of medical records, medical terminology of the unit supported, computerized data entry, and information processing systems to be used by the facility. See if it says anything else. Okay, so the impact of automation. Automation greatly affects the way health services are developed, delivered. Employees use computers to perform a wide range of variety of correspondence and track and input, delete, retrieve, manipulate, correct information in databases or automated records. And so are we thinking that if the person is transcribing into automated records? And so they design and produce reports using automated computer, although medical record technicians and medical support assistants use computers to perform basic work processes. Knowledge of rules and processes in the medical support arena remains paramount. Subject matter required to perform the work. The kind of automation tools and the skills required to use them generally replace or supplement work methods and techniques previously performed through manual or machine enhanced processes. Okay, and so let's look at the other one, the 270, 570, 675. Oh, it took me all the way out. Let me do this. Let's look at the 675 again. Okay, so the occupation for the medical records technician is the medical records technician assemble, analyze, code, abstract, report, maintain, and extract medical records information. They organize and check medical records for completeness, accuracy, regulatory requirements, federal medical centers, medical staff, medical records. The federal health care facility maintain permanent records, accurate records. I haven't seen anything that said anything about transcribing so far. Accurate medical records for diagnosis and treatments. Specific duties of a medical records technician vary within complexity and characteristics of the facility. Use of the latest treatment methods by healthcare professional results in comprehensive records in cases with many diagnoses and treatment. Time and knowledge needed to analyze and code the records increases the proportion of the patient's length of stay. The scope of the work performed by the medical records technician is increased when there are many health care providers involved in a single patient. Several physicians may provide care to one patient. I'm trying to see where they transcribe data. Medical records technician must also have knowledge of medical terminology and uses covering the full range of general medical, surgical, medical records and formats, correlation of laboratory tests, medical records classification, legal documents, laws and regulations, assistance. We can now goes to the assistance. Okay. So all of that. So the 675 did not say anything about transcribing data.
Mhm.
The 679 has a broader um purview in the clerical work because they're doing other stuff. They're serving as the receptionist, performing records keeping duties, and providing miscellaneous support to the medical staff. Do you see that in that position?
Mhm.
They're not serving as a receptionist. They're
No.
performing records keeping, they are performing record keeping duties, but they're not, that's not the sole purpose of the position is the receptionist.
Right, because they're not in the front line.
Right. And so they do have to have a practical knowledge of data entry, but data entry is not transcribed. So what series had the transcribing in it? That was in the 300, right? I want to say it was in the 300.
Which one?
The transcript, the transcribing information.
Yeah, I think it was 320
Three,
something. Uh, it's further down.
three,
It's further down.
further down. Data transcriber series,
Mhm.
356. And so basic requirement for all data transcriber positions is the ability to operate keyboard control data transcribing equipment at an acceptable level rate of speed and accuracy. Hmm. This one says in the first nature of assignment, the data transcribed normally requires use of numeric keys only. Nope, because they're only doing codes. So if they were doing coding and billing, I would use that standard, but they're not doing coding and billing. So it's, I think that the best one that fits to me is the Office Automation Clerical and Assistant Series.
That's what I chose.
The 326.
Hmm.
And
But I
so
wanted to
you
make
have,
sure.
yeah.
Well, here's my issue. The three is it 303? The
Hmm.
303 is the miscellaneous one, right?
Hmm.
So I wanted to make sure that I was not missing something to justify, you know, going with the next one.
Okay, and so this series includes all positions, the primary duties of which are to perform office automation functions, which includes word processing, either solely or in combination with clerical work when such work is performed in context of general office support.
Hmm.
Okay, knowledge of office automation software typing. Let's look at the 303. 303. This series of position. This series includes positions, the duties of which are to perform supervised clerical assistant or technician work where no other series is appropriate. Requires a knowledge of procedures and techniques involved in carrying out the work of an organization and involves application of procedures within the framework of established guidelines. And so you're probably better putting it in the 303.
Hmm.
And then you would have to go to, because this is a flashy, one grade interval work, not and the primary purpose is not classifiable in any of the series. And then you will go to the flashy. So you would use the 303 in addition to, you'd have to pick a guide because it doesn't have any criteria. Normally we use the grade level guide for clerical and assistance work to get the criteria. And so because this is a medical position, let's just make sure there's nothing else. No, so you wouldn't use that. So you would use the grade level evaluation guide and the 303 flash sheet. And so the best fit to me is the 303.
versus the office automation because of the fact that it has the correspondence portions to it.
Yes. And so you wouldn't use the 356 because they're if
Right. Yeah, I
they're
got that. That's administrative.
no, the 356, no.
What was the one that was yeah, that was the one that was administrative. They said it was the two grade interval, I thought.
No, that was the three something else. That was a 569 something, I don't know. This one is clerical. It talks about this position covers and involve operating or supervising the operation of keyboard control machines to transcribe or verify data in the form that can be used in automated data processing systems. And so my definition of, and so my lack of knowledge of the medical equipment hinders me here because it's a transcription um, equipment that they use. Is it considered automated data processing equipment? And I would think not.
Yeah, no.
And so, one skill in operating a typewriter or a modified typewriter style alphabetic numeric with acceptable speed and accuracy, and two, the ability to understand and apply machine operating and data transcribing procedures. Data transcribing work is combined with clerical work. If combined with clerical work, is covered in this series unless the clerical work requires specialized training and experience. And so is this data transcribing? And so now I'm back to it's either 303 or 356. And so does it say in the PD what type of equipment it is, or is it transcribing it on a regular computer?
Let me pull it up. Okay. All right. You can see the screen.
Um, yes, I don't. Yeah, I see it.
Okay. So, so the other thing is pay attention to this part here, which is why I highlighted it right here. The incumbent is responsible for providing program support by planning, coordinating, and performing a wide range of daily critical administrative programs and technical functions to assure blah 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 blah.
Okay.
Um, so now we
And
get
that's in the
to,
introduction. So let me see what it says in under administrative support under major duties. Then it's 303 and not 356. They got the series right there.
hmm?
They put the series right there in the head and they forgot to take it out.
Oh, let me make sure I got the right. Make sure this is the right document. No, this is no. This is the wrong one.
Oh, okay.
Let me make sure I got the right one first. Um, let's see.
Because this one doesn't say anything about transcribing in this opening paragraph.
I'm sorry, I pulled up the wrong one.
Okay.
This one here is the one that's got zeros. So, all right. So, income will provide general clerical. All right. So we know it's clerical because it's already it's stating that there.
Mhm.
So it's got to be a one grade. It's got to be one grade and available. No problem. Effective communication with providers throughout the service. Excuse me. Will be necessary to clarify any questions that may arise while preparing the reports.
And so what's
Uh,
the percentage of the other one?
well,
Because
they
I'm
made
still seeing the old one. I'm not seeing the new one.
yeah they made a mistake. So this says 70-40. It should be 70-30, but still.
So
So
70% includes the regular office clerical work plus the data transcription. I mean, it's transcribing the records.
well that's part of the first 70%
That's part of it.
office support work here.
Yeah.
So this other part of the correspondence, which is still 40%, is more about communicating the information out from
Communicate
that.
information out or
Well,
transcribing the information.
it's right here. So formats and produces accurate medical reports that become permanent portions of the medical record for medical, legal,
So then it's 303.
and
Our
that's
purpose
where.
of the position is it falls into the 70.
So, but so where do I go from there? Because if the first part of this is the transcribing portion of it, and the second part is the correspondence portion of it, like what would this should be if this is combining two different series, what series is this with this correspondence part?
303. When no other series is appropriate, you use the 303. When no other series is appropriate, for a clerical position, you use the 303.
Mm,
And remember, again, the primary purpose of the position is clerical. And so, because there's no specialty that talks about transcribing medical records along with doing clerical work, then you would use the 303.
mm.
I would use the 303. I would
Okay.
use the 303.
Mm. All right. So to justify using the 303, um,
You would have to say why you didn't think it was the 356. I guess what that was, or the other two 300 ones, and those two 600 ones. You'd have to write down. So those the 675 and the 679, the 303, not the 303, the 326. Um, I'm sorry, I closed that page prematurely.
That was 326, not okay. That was 356.
It was a
326.
326 is office automation.
Mm-hmm.
But it's not 326 because it's not primarily doing office automation. It's doing other office work. So you know you
Well,
and
I
so if
think
you
so. That's where the problem was. I think inside the 326, I thought I read that it mentioned something about it does do other work coverage, suffers from demolition.
well, it does. It says series includes all positions, the primary duties of which is to perform office automation work. But is the office automation work the primary purpose of the position, or is the clerk either solely or in combination with clerical work when such work performed in the context of general office clerical support? Now, the other key is that if you look at the titling section in the 326, and so
Mm-hmm.
I'm going trying to get to the tech to the title would have to be office automation clerk or office automation assistant. And I don't think the title is conducive for the combinations of the work being performed. And so you have to use a prescribed title, though they may fit into this category. You could use a title, you could use the 303 series, give it the 303, you can set your own title. Okay?
Right.
You can say what your own title is in the 303 series.
Right.
And you have the ability in the 303 series to add a parenthetical. So you could say, medical, clerical, whatever, and then all in parentheses put office automation.
Mm-hmm.
So the process of elimination is this person strictly office automation doing some clerical work, or is this position strictly clerical work doing some transcribing? See the difference?
Mm-hmm.
Office automation work doing some clerical office work, or office clerical work doing some data transcribing.
Well, going back to the PD, and this is where the issue comes because this person is responsible for accurately and efficiently completing a variety of dictated reports
Mhm.
using office automation systems in order to support the team.
And that's in the first part or the second part?
Hmm?
That's in the first part or the second part?
That's the introduction. That's an introduction. This here.
Yeah,
Can you
that's
see
it.
it?
No, you got still got the other one up, the women's
Oh,
health one.
um,
You have to stop sharing this one and then share that one. What I'm saying is you can still put office automation in parentheses for the 303.
but give it what title? You know what I'm saying? Like giving it what title though? Because you're saying I can do the office automation portion as the in parentheses portion, but what would be the main title and how can I justify that title, me giving it that title?
And so normally what you do is when you look at a title, the 303 series does not prescribe a title.
Mm-hmm.
And so what you want to do is you want to look at your 303 when determining the title for your agency. You want to look at the 303 titles and zero them down to that office, the Health Information Management Office. If they have other 303s, what are their titles? And so I would,
I did that. I went to our library and I'd have to log in to see what it was.
mhm.
But I think the 326 and the 303 both were in there. Um, but because this
Can you
is a
move? Can I
test,
see under office support? Can you move it up so I can see under office support? Okay, thank you. Right there. That's good.
so this is the primary function, 70% or 60%.
Right. Then I will go with the 326. If you yeah, corporate transcript needs of the yeah. Uh, can you go to the factor one? And so even because in the major duties, even though they have the transcription first,
Hmm.
and that's 70% of the work,
Hmm.
and that they must be proficient in office automation software programs. They must be a skilled typist. They must be proficient in office automation software, electronic, you didn't highlight it, but electronic spreadsheet skills. Incumbent will possess word processing skills to include the ability to copy, delete, and insert and move text, office automation. And so you notice in the knowledge, they don't mention the transcription at all. I don't see it in these bullets.
Mm-hmm.
And so if they mention transcription in this knowledge required of the position, the
Mm-hmm.
ability to read and understand and transcribe, I don't see that anyway. It's all talking about office automation stuff.
Mm-hmm.
And so that's why you have to look at the entire PD. You can't just read bits and pieces of it. I like,
Mm-hmm.
look, and I'm color coded, girl, so I like the way you got that stuff color coded.
Mm-hmm. Mm-hmm.
And so as you get the final printed document is 4 minutes, that's office automation, making sure you know how to.
Say again.
I would think the knowledge and skill required so that the final printed document is formatted in a professional manner. That's clerical, typing, QA, new research studies. Uh-huh. And then say anything, even though it sounds like in the major duties, that transcription is what the primary purpose of the position is. But when you look at the knowledge required, the primary purpose of the position is operating that equipment to do those things.
Mm-hmm. Mm-hmm.
Productivity and accuracy, proficient office automation software, assist with projects assigned, research studies, spreadsheets. That's office automation, graphs, spreadsheet, office automation. Delete, add, otherwise modify spreadsheets, office automation. Formatting documents, office automation. Incumbent will possess word processing skill included, which includes the ability to copy, delete, office automation. It also includes the ability to have software program automatically number pages, office automation. Knowledge and skill required for the final printed project is formatted. They got that twice. Knowledge and skill are required so that the final printed document is formatted. They got that 3 times. You see that?
Mm-hmm.
Then you can holler assist with projects when assigned by appropriate staff member. When I look at this, I see office automation. I'm not talking about anything about transcribing, even though they make it prevalent in the major duties.
Mm-hmm.
Everything in these knowledge required is related to office automation.
Mm-hmm. So, so we also have to keep. What about this portion here? This correspondence portion here. This 40% part formats produces accurate medical reports.
Yeah, that's just regular clerical work. That's the other clerical work that it has in the 303.
But my only issue is that it's more than the 25%. And
Oh, you mean
so
it's
that
more than
it's more than 25% as far as the
so
importance.
the primary purpose of the position, the percentages help you determine the primary purpose of the position.
Mm-hmm.
And so the 70% will be the primary purpose of the position for my knowledge, for my
Right,
understanding. And though,
right.
even though it has other things in there that relate to, um, that the correspondence is still office automation, work processing for documents, maintaining confidentiality. That's minimal stuff. Computerized patient records and electronic mail functions. Regular correspondence duties are completed in using and creating templates. That's office automation. Formatting documents. That's understanding how to use the software to format a document. Responsible for dictation as designated by either telephone or notification by a provider to the lead transcriptionist supervisor. I'd like to know what the series is that lead transcriptionist. That'll tell you something at the bottom, that last sentence where it says lead transcriptionist.
Mm-hmm.
I wonder if the lead transcriptionist is a 326, the position is a 326. If the lead transcriptionist, that would be my process of elimination. I would go look and see what the lead transcriptionist, because if you use the 303, let me tell you, you can title this position transcriptionist, medical transcriptionist, or medical transcriptionist. Let me see what the titles are now. I know it's a lot to process, isn't it?
Yeah,
It's a lot to
that's the
process.
thing. But that's the thing. The PD says stuff that to me is controversial, and I don't have the option of being able to send questionnaires to the hiring manager
Right,
and all that stuff.
right, right.
They
For
give
this,
me
because it's a learning exercise. And so
right.
the key is looking at the position as a whole
Mm-hmm.
and not just focusing on what's in the major duties, or not just focusing on the information in the factors. Try to put it all together and see what the primary purpose of. And so when I look at all of the things that are required for the knowledge,
Mm-hmm.
it says in my mind, even though it has all that other stuff under that 70% and that 40%, this is what I need you to know how to do. Because if I know how
Hmm.
to do this, I'm gonna be able to do that stuff in the 70% and the 40%.
Okay. Now, my understanding is what's in the introduction and in the duties needs to align with factor one and obviously number 1 and 4, which are the most
They should
pertinent ones.
complement each other. They don't have to align. They should complement each other. And so when you
Mm-hmm.
go to evaluate the position, you should be able to say, okay, well, what level is it? And so it's, right here it says the incumbent must be skilled typist. Well, why they're skilled typists? They're skilled typists because they must be able to transcribe that information that they're talking about in the major duties. Why do they need to be a skilled typist? Maybe something in the introduction that talks about them being able to have, type something. And so they must complement each other.
Mm-hmm.
Sometimes you'll get position descriptions um, that the information in the introduction has nothing to do with whatever the position is about. Y'all's are very um extensive compared to most agencies. Usually it's not more than a paragraph. And the introduction is supposed to introduce the position to the reader, where the position is located, um, what is the primary purpose of the position could be included in the introduction, but it has to align with, or it has to complement everything else that falls in the position description. It can't say that I'm responsible in the introduction. This position is responsible for shoveling snow, and then no place in the PD does it discuss shoveling snow, what techniques and tools that need to be used. It has to complement each other.
Mm-hmm. Probably should have highlighted this part too. This might be critical to know as well.
They repeated that 3 times.
Yeah.
They repeated that under that 3 more times, 2 more times.
So
I
I
don't know
got
whether
to
it's just a typo or
Oh, I got to take heed to that. If that's
yeah, yeah.
so the printed document is formatted in a professional manner.
And so the data transcriber 356.
That was the one we ruled out because it was administrative.
No, this one is clerical, right? The 300 was that was a 600.
Okay, you said 356.
It's 356. And
Okay,
so it
three.
says if data transcribing work is a significant portion of a position and must be performed at high speed and accuracy, the parenthetical title could be data transcriber. Hmm.
It's not pulling up on my screen. You can show yours because it's not. It's doing that buffering again on mine.
Hmm.
Hold on 1 second too. Uh, just want to grab my candy. Once. All right.
To transcribe or verify data in a form that can be used in an automated data processing system, work requires skill in operating a typewriter or modified style typewriter with acceptable speed and accuracy and ability to understand and apply the machine. Let me see what a grade 4 is required to do. And so remember we said lead that the other person was the lead transcriber? And they said they do some report something to the lead transcriber.
Mm-hmm.
Yeah, so that for me, this giving me the this giving me a feel of sitting in a room with a bunch of people just putting keying in data.
Hmm.
That gives me the feel of nature of
That's what.
assignment. It measures the variety and complexity of the procedures being applied and how specifically they cover the work to the extent they are complicated by variations of exceptions and variety of and complexity of the source documents with the extent that they are standardized, edited, and encoded, the nature of the machine's program requirements. That thing doesn't say anything about pro. It only said something about calling somebody to in case of emergency to fix the work, fix the computer, right? Under
Hmm.
context. It's trainee. This position is not a trainee. That's a grade one. Grade two. Continuous performance of assignments at the level described. And so this series so far does not cover that correspondence, that 40% correspondence. It just only talks about somebody sitting transcribing.
Doing basic clerical work.
Well, just sitting there doing just transcribe. That's all they're doing is transcribing. They're not
Right.
making copies. They're not working on
Right.
reports. They're not. They just sitting there all day transcribing data.
Hmm.
They normally get batches of documents covered by standard instructions. Nope, let's see, three. Complicated data transcribing and verifying assignments which require knowledge of extensive body of procedures. Data scribers operate one or more kinds of data key equipment to perform transcribing or verifying work complicated by the following conditions. Assignments require skilled use of full keyboard and transcribing alphabetic procedural instructions applied to extensive both numeric content. Contains numerous data items to be described and required a number of separate cards. I keep talking about them cards. They need to update this standard. I still think 303. I
Hmm.
so you I think your best bet is to make a decision between the 303 and the 303, the 326.
Yeah, that's where my
I
issues were.
I think it's 303 because with the 303 you can give it any title. And so if it's going to be a medical support assistant, it's going to be a 303.
Hmm.
That's normal within your agency, then it's going to be a medical support assistant at 303 or a medical support assistant with transcription, transcribing in parentheses because you can put anything in the 303 series. You can make any title.
Hmm. All right.
That's a
All
lot.
right. Yep, that's what I've been
I
working.
would go with the 303. I mean, I would. You have to make the decision. But the key for you is to be able to justify why you came up with the series that you came up with and the grade that you came up with. And so you
Mm-hmm.
need to do a comparison. Um, I'm not supposed to do this, but I'm gonna go ahead and take that chance. Um, and so in the you took the 2 week class or the 1 week class?
Two.
You took the 2 week class. There's a section in there on charting. And so in that charting thing, it talks about the levels, whether you think it's 1-1, 1-2, 1-3, 4. But you can use that same premise for charting your decision about where you would let me do this. How you would determine what the series is. If you have to justify how you determine what the series is, I would do this.
Mm-hmm.
I can't find what I'm to. Oh, hmm. And say 303 requires
Mm-hmm.
A, B, and C. Oops.
Mm-hmm.
A, B, and C.
Mm-hmm.
And then you may want to say a little difference between why and what you chose.
Gotcha.
Right. And so you can read because it's a lot of information and you want to be
Mm-hmm.
able to put it in a way that you can process it because you're a thinker. You're gonna analyze stuff till you get down yourself down into a rabbit hole. You're gonna be back and forth, back and forth, back and forth, back and forth. But if you can
Mm-hmm.
see it clearly, it should help you hone in on where you need to go. And so you can list what the standard requires. The standard requires knowledge of just regular clerical work. This one
Mm-hmm.
specific data entering.
Mm-hmm.
So you can distinguish one series from the other. And
Right.
and then at some point it'll once you line it up side by side, you know how you say when you're gonna buy something you want to compare this
Mm-hmm.
model to that model,
Mm-hmm.
so you can see it.
Mm-hmm.
But because it's a hospital and because
Mm-hmm.
it's not 100% data entry, that data transcriber one, I don't think it's going to work. But I do know that there is some correlation between the 326 and the 303. The only difference is with the 326, you have to use that office automation title. With the 303, you can use any title and put office automation in parentheses, or you could put data transcriber in parentheses. You can use either or. Okay? All right?
Yep.
All right. I think that's
That's
enough
good.
for you today.
Yep.
And so we're gonna go back over that stuff. You let me know. Next week I have to go into the graduate school Monday, Tuesday, and Wednesday, but I still should be able to do Monday Tuesday because Tuesday's a light day for that class. If you want to do next Tuesday, just let me know.
All right. Um, all right. Yeah, I'm going out of town on Wednesday. So I
The
I
12th,
got,
the 13th, or something.
yeah.
So you need to
Uh,
have this done by then? You
yeah,
and
this has to be completed by Tuesday. Um, it was supposed to be Wednesday, but I'm probably going to take a couple days off next week for a funeral to fly out of town. So I got to have it
okay.
really ready to go on Tuesday. Um, so he can be all set. And
Okay. And so if you need to email it to me, you have my email address, right?
yeah,
Cynthia.Robinson@gmail. And so if
hmm
you want to email it to me, you can email it to me. I can go over it. And then you tell me when you want to meet again.
all right, all right, will
Okay.
do. How much
All
are you
right.
for today?
Um, half of what you gave me last time.
Okay,
All
all right.
right.
I'll
I ain't
send them the
trying to
link.
break your bank.
Yeah, all right,
All
no
right.
doubt. All right, appreciate you.
All right. Thank you. I'll send you the recording once it processes.
Yes, I need that.
All right.
Yes. And last time you were supposed to be sending me some document. I can't remember what it was off the top of the head. Um, but you're supposed to be sending me a document. It was some kind of Oh no, I'm sorry. We realized that I think I might have had it already. Um, I'll go back and listen to
It's
the first
probably
one.
page 23.
It's
It's probably
23.
page 23 in the or 25 in the book.
Suspicion guide.
Yeah, and I'll go back and look. I'll try to go back and look at the other video and see if I can figure out what I was supposed to send you.
Okay.
All
All
right, I'm
right.
I'm juggling
All
12,
right.
12 balls in the air at the same time, so give me some grace.
No problem. No problem.
All right,
All right.
have a good evening.
All right. Thank
All
you
right,
again.
you're
Appreciate you.
welcome. Uh-huh.
All right. All
Bye-bye.
right. Bye bye.